This is the third in our series of 4 videos looking at how exposure to red light can enhance our health and help us heal. Hello again, welcome to the Live Long and Master Aging podcast. I'm Peter Bowes. This is where we explore the science and stories behind human longevity. Dr. Zulia Frost is a medical doctor and the clinical director at Recharge Health, creators of a targeted red light device known as FlexBeam. Zulia, welcome back.
Thank you so much, Peter, for having me again. I am excited about the topic today. So let's start it.
Yes, let's start it. And it's good to talk to you again. We have covered in our previous episodes the background. We've talked in some depth about red light and sleep and anxiety and how it can be applied to ourselves on a daily basis to improve our health, help us get a better night's sleep. What we're going to talk about today is aches and pains. So that could be muscle pains, it could be tendon injuries, it could be joint issues that may or may not be associated with aging. There really is quite a lot to talk about. So maybe I could get you initially just to lay out the issues as you see it and how red light could potentially help us.
Oh, this is very, very important topic because most of us in our life experience pain. And they could have been pain because of the injuries or could have been pain because of some illness people experience. And interestingly enough, the majority of people who look into to buy FlexBeam device, they look in especially to manage their pain, although their actual device is designed for energy, for optimization of health. And I tell you why, because one of the major effects from red light therapy on the physiology of the body is to improve local circulation. And pain often associates with the lack of oxygen in the tissues. So because there is a lack of oxygen, you get that achy sensation and dull ache pain. For example, and of course it could be relieved by simply improving circulation. So this is the easy one. But of course, if we're talking about skeletal muscular conditions, arthritis, for example, you have combination of joint pain, muscular pain, and this is all as a result of some often prolonged muscular spasm. So what's happening when some muscles stay spasmed? They become actually the fibers of the muscles become not pliable, so they don't expand and contract. So they become staying in a solid way. So belly of the muscle shrinks, and then there is a more stress on the tendons which attach to the bone both ends. So you have the perfect situation for really painful condition. So in addition to that, blood cannot flow freely through the fibers because they are like a wall, they become dense. So of course the solution in such situation is to improve circulation and relax muscular spasm.
Is it fair to say then that, generally speaking, pain can be divided into two categories? Pain that is indeed associated with aging, but also clearly pain that's associated with injuries, whether we're playing a sport or whether we fall or hurt a limb or hurt a joint. That clearly is going to cause pain potentially in multiple parts of the body.
Yes, we have, of course, when we go through aging, our cells don't have right metabolic rate or processes. They typically compromised by poor functioning mitochondria. So here you would find FlexBeam very useful because it helps to optimize cellular energy production, but at the same time, it improves that circulation. So both issues are addressed. In my practice, actually, I encounter a lot more complex conditions like neuropathic pain, because maybe some neurons not firing properly, or it could be central origin coming from the brain or spinal cord, or could be peripheral like sciatica pain, etc. So the origins of pain is massive. I mean, could be anything. but they typically, in all conditions, in my view, I divide them into that poor circulation situation and compression. So when this very, very tight spasm muscle compresses on the nerve, of course, nerve going to be screaming, firing, and causing you pain. In such situation, again, we can use FlexBeam to relax muscle and improve local circulation.
Let's just recap how FlexBeam works. I know we covered it in the first two videos, but I think it is worth, in this context, just recapping FlexBeam and how it applies red light to our body.
First of all, FlexBeam would stimulate with light energy center of the cell. So this will be stimulation of mitochondria. So through stimulation of mitochondria, the cell makes more energy. This is really positive factor because without energy, our cells cannot simply function. And then second effect is as a result of binding more oxygen in this mitochondria, their light also helps to release nitric oxide into the blood stream. And nitric oxide dilate blood vessels, which means at the area where you irradiate, you get a lot more blood flow. In addition to this, we know that red light therapy, generally red and near-infrared lights, also stimulate collagen production. We all know about collagen in terms of aesthetics, but collagen is everywhere in the body and also engage in the process of wound healing, for example.
Can I just ask you about nitric oxide? Because I know a lot of people, athletes in particular, will use supplementation for nitric oxide, whether it is for more energy in sports, but I also know some people who actually just use it for everyday energy throughout the day. Can you explain to us exactly what is, I know you've touched on it, but in a little bit more detail, exactly what is happening and how it is indeed similar to the effects of red light?
This is absolutely important. As we talk through concept of mitochondria, I always explain these processes like you dancing with a partner. So you have two partners. One is oxygen, one is nitric oxide. If you prefer oxygen, so mitochondria binds better oxygen, the nitric oxide stays away. So of course, it kind of kicked out of the dancing floor. So the effect of nitric oxide, as we talked before, is to improve circulation locally. So that is most fundamental for many physiological processes in the body. In terms of even in terms of inflammation, because inflammation is the reaction of the body to any insult, and it's becoming unproductive when becoming a chronic inflammation. But of course, inflammation associates with the first, so increased blood flow, and then ischemic state when there is a decreased blood flow at the site of inflammation, and you see the tissues become depleted, achy, pale. And then again, we need this process in order to alleviate this pain.
And once again, I find ourselves revolving right back to that issue of mitochondrial health, which really is absolutely, isn't it, central to everything?
I totally agree with you, because in my view, in many years of me trying to comprehend what is the cause, what is the beginning of the problem, I now absolutely came to realization in almost every single illness, the core is the dysfunction of mitochondria. And if we can address this as very simple way without any side effects as red light therapy, I mean, that was already, I would say, 50% the solution of the problem. So red light therapy in this case, everybody should have it.
Now, I referred to aches and pains and injuries, perhaps even serious injuries that are caused by an accident, or for athletes who get injured during their sport. The first protocol for most athletes when they, let's say, injure an ankle or Another limb will be to reach for the ice and to rest significantly for an extended period of time if it is a serious injury. Can you just talk about that and how it correlates with what red light therapy can do for us, especially in terms of the icing on a limb?
Mhm. Yes, you're absolutely right. The first measure would be to ice. There is a reason behind it, because ice does exactly opposite. It vasoconstrict, which means it reduces blood flow, and we do need it at the beginning, because at the beginning, when the insult on tissue happens, the blood vessel is ruptured and blood start leaking. And we don't want this, because then it creates massive bruise, and that bruise may be compressed on certain tissues, and it causing pain and inflammation, etc. But the idea that at first, with any injury, you need to make sure you complete it with a stage when you coagulate blood vessel, it's blocked, it stopped leaking. Ice is really helpful at this point. But the minute you created that, you block you stop the leakage of the blood and you block the vessel through coagulation, then you can straight away start using your red light therapy device. Why? Because it's going to optimize the whole healing process. Throughout all three stages of healing, you can only give most favorable conditions and environment for healing.
So let's talk about specific parts of the body, those commonly injured parts of the body that really cause a lot of grief, certainly for athletes, for runners, for people who want to regularly work out, for hikers, for climbers. I'm thinking of knees and ankles, the two very common areas where injuries occur. What kind of practical use can the FlexBeam be for someone who just goes over on their ankle, twists their ankle, and there's that realization, isn't there, instantly that, oh, I'm going to be out of it for several weeks now because there's very little, as we've just talked about, icing and long-term rest. That I think generally people think that there's very little they can do to speed up that process of healing.
You're absolutely right. And that's why it's very important what we're discussing now. People need to know that tools like this exist. Because when you use FlexBeam or other red light therapy device, you would be able to speed up that healing process. How? Of course, first, and I tell you, I sprained the ankle and I use my FlexBeam for that. So I'm very, very familiar with that. So the minute you sprain, of course, you need to put the ice, put the leg up, make sure you don't walk on it. That's, by the way, why body creates pain for us. So we don't start, we stop using this limb for walking. And then immediately I would start using the FlexBeam, because first of all, at that stage when suddenly blood rushes to this ankle, it's become swollen, hot, painful to touch, you need energy to facilitate the healing process, and you need blood presence. So a lot of blood going to flow there. But at the same time, what you're going to see that after 10, 20 minutes of use, the ankle puffiness started to come down, because it produces anti-inflammatory cytokines, or little messengers saying, okay, we're doing okay with the blood flow. I don't need to inflame my ankle so much. So the body starts reducing that puffiness. And then when you do it twice or three times a day applications, and approximately 3 to 5 days, that horrible, heavy, acute phase, it's becoming easier. So effectively, you can probably put weights on it already on a day 3, of course, depending what kind of, how strong the injury is. In my case, I was walking already on day 3. But I've seen patients post-surgical with the knee, like ACL injury, very frequently happen. Anterior cruciate ligament injury, and again, bruise, swollen, hot. Use the FlexBeam straight away, and use it daily, but not just once, 2-3 times a day, local applications. And the longer in time you go, the longer you will need to use FlexBeam. For example, if you injured ankle a week ago or knee a week ago, and you only got to FlexBeam point right now after 1 week, it will take you longer to get the same result if you use immediately. If you use immediately, you're going to see spectacular resolution. And that's what I love seeing when we do case studies, because we obviously say straight away, here your device. So it's quite profound.
But equally, people need to be patient.
Oh, yes, yes, yes. Of course, I'm not encouraging you, using FlexBeam and start working on it, because nature does it for a reason. You need to slow down, and you need to be mindful that you don't need to walk, put weight on it. But as your body recovered faster, you would be able to do things faster. I mean, if you say in normal injury you can put bearing weight after 1 or 2 weeks, you would be able to do it a lot sooner, like 3 to 5 days. I have experienced that. In average, what feedback I get from therapists who are using it, from myself, my experience, I would say 30% faster improvement if you use FlexBeam throughout the recovery.
Well, that's quite significant. Let me ask you about fascia. I know plantar fasciitis, that awful pain that so many people get, and this does seem to be associated with aging, although I know a lot of younger people, again, especially athletes who suffer from this, that awful pain that you get in your feet, usually first thing in the morning, tends to go away a little bit during the day with exercise. Is red light something that could be applied here?
Oh, absolutely, absolutely. First of all, remember structure of the fascia. Fascia consists of primarily of the collagen, fibrin, fibers, and which triple helix, and it's just kind of immersed in these fluids, body fluids, yes, glycoproteins, and so we need to restore that natural state of fascia, elastic, pliable, bouncy collagen, yes. And what can do this better than red light therapy? I don't know, because red light therapy impact collagen by making it a much better quality, as I said, and it also helped to bind to water molecules, so it's become more hydrated. So altogether, I mean, on physiological level, it's good to use FlexBeam right on the plantar. But I must share this here because it's so important. People always tend to look at their problem in isolation. Like they say, oh, this is only on my, bottom of my foot. No, there is a very, very close link with the problem somewhere in your sacrum, believe me or not. That's what I found through my clinical experience. So, for example, if people have sciatica pain, so the nerve somewhere compressed in the sacrum, and it starts firing. And when it fires, it's make muscles in the back of your leg to become tighter, tighter, and tighter. And then muscles of the calf will be pulling the tendon, pulling on and ripping off maybe of the heel bone, and affecting the fascia, because the whole structure, body mechanics changes. So my advice, whenever ever you have plantar fasciitis, put FlexBeam over the plantar on the bottom of your foot, but also apply at the calf level and sacrum level. Then you're going to get resolution of your problem. So you need to do at least these 3 positions daily, with some occasional breaks, to get the resolution.
And would you recommend doing it every day or taking a break for a couple of days during the week?
Yes, it's important to know, of course. Really, it's depend. If you have it just happen, then you could use daily, okay? And I would use this interesting sort of regime, Monday to Friday, and then weekend off. This is just to introduce some kind of break. But if you use, if you are already having the problem months and months, or even some people have years, daily exposure would probably be a little bit too much, because the body used to that condition. The body now adjusted to this state, and you need to take your body and create a new habits. So use it maybe every other day, but it would take a lot longer for you to resolve the problem compared to people who have just acquired this condition. Then it would be faster.
Yeah, and as you've explained, really, use red light, I think this is what you're saying, in association with other treatments and other therapies. And a common one for plantar fasciitis is simply stretching, and a good stretching regime that I know a lot of people have persisted with for many years with some good results, that these treatments can't be or wouldn't necessarily be advisable to use totally in isolation. It's you need the full picture.
You're absolutely right. I am for multimodal approach. So I would also have a visit to chiropractor or osteopath, maybe to release sacrum a little bit, trying to figure out what is compressing there, why muscles are so tight. You can actually feel it when you palpate. Yes, massage is good. Even acupuncture, dry needle acupuncture is good. Various other form of therapies are good. I would say electrical stimulation, So yes, total approach is better than just one single.
I gather a lot of professional athletes are using red light therapy now and are actually working with you. What kind of results are they getting?
Oh, absolutely. I'm very proud to share that we have number 4 tennis player, Casper Ruud. He joined us as our brand ambassador, and he genuinely using FlexBeam almost on daily basis. So we know that he's using it to reduce his fatigue, maybe to address any of his injuries. He's a big fan of FlexBeam.
I am Casper Ruud. It's finally time for me to unbox the FlexBeam. Here we go. Let's open it to see what's inside. Your FlexBeam story begins here. Instructional book. The real deal is in a nice box. Let's open it. I know what's inside, but it's the first time I'm unboxing the whole thing this way. The device is here. Some bands to fit your body. Safety goggles. Chargers. British, European, American, I don't know, Australian, I think. Remove the stickers. Quick start instructions. Press the button for 2 seconds. It's on. You choose program 1, 2, or 3. You press start, and the lights will go on. The infrared lights, you use them to penetrate through your skin and down to muscle tissue or any sort of injury or ache or pain that you have. I typically use it for my arm, especially after a lot of serving. It makes the muscle tissue recover faster and be ready for whatever challenge or whatever pain you're having to recover faster and be better the day after. I can show you. Press start here. You can use it in your neck, also very easy. It's ready for use whenever, wherever, even on the plane, when you're at the office or the couch at home. You can use the FlexBeam as long as you want, but the program lasting 10 minutes each. I find it that 10 minutes is usually enough. Close it. Doesn't take much space. You can hold it like a little suitcase, or this way. The FlexBeam goes with me everywhere I go, so I keep it with me all the time.
Also, FlexBeam is used by athletes in football, in rugby, in athletics, in running, arm wrestling, and boxing. Many athletes actually quite liking it, because what you could do with FlexBeam, you can not just address the injuries, but you can also prepare yourself for better function. So you could use FlexBeam approximately an hour before your competition or tournament. In this case, you would be placing the FlexBeam over the muscles which you're going to be using the most, almost like it's a warm-up procedure. You could also use FlexBeam to prevent or reduce the fatigue, because, for example, in the gaming sport, you have very short time for athletes to, like ice hockey, for example, a short time when athletes playing, they need quickly to recharge the muscles, so to speak. So again, you could use FlexBeam for this, or if you've done marathon or serious like tournament, then you have time to recover approximately an hour after your competition. Again, you can place over the muscles and help yourself to recover from fatigue faster.
And I think the aspect of this, at least to me, that is most interesting is the preventative side. And you've talked about athletes in terms of preparing themselves. Would that apply also to any of us, especially as we grow older, that red light therapy can, in a way, be used as a preventative measure just to hold off the potential possibility that we're going to be injured, whether it's just our everyday life or taking part in sports, that it can be used. And it's always interesting to me, and perhaps even more important, that we focus on preventative health as opposed to always talking about treating an injury or treating a disease. It's far better not to get it in the first place than to take action to make us healthier, to make us stronger, hopefully so that we don't suffer from these ailments.
I'm so happy you're talking about this, because this is my focus of work all my life. I always talk to my patients and explain that, if you invest in your health now, you're going to be having wonderful, maybe, you're getting older, but you're not getting older so fast, and you absolutely no pain. You enjoying your life at any decade in your life. So absolutely agree with you. FlexBeam, to me, in fact, a rejuvenation device, because it stimulates mitochondria. It gives body energy to function. And of course, all of us, especially when we go through this aging process, nobody likes. If we use the FlexBeam, we can optimize our energy reserves in the body. In terms of workout, what I found, and lots of our users telling me, that if they use it before going to the gym, like most people go and exercise in the gym, and what they could do, they can actually perform better at the gym. So if there are women trying to shift weights, obviously after menopause that could be an issue. So if they use FlexBeam beforehand and they go to the gym and they exercise, they can actually run further, they can actually push more, they can stretch, do a lot more sequences than they would do without it. So in my view, this is absolutely the tool which needs to be used on regular daily basis as a routine, maybe sometimes in the evening, maybe sometimes in the morning.
Well, I think the issue is fascinating. For the time being, Dr. Zulia Frost, thank you very much indeed.
Thank you, Peter. Thank you very much.
And if you would like to try for yourself, Recharge Health is offering Llama podcast viewers and listeners a discount on the purchase of a FlexBeam unit. Use the code Llama at checkout. You'll find full details in the show notes for this episode, either on the platform where you are now or our website, which is llamaPodcast.com. That's Live Long and Master Aging, LLAMA podcast.com. In our next episode, we're going to talk about red light and our digestion, our guts, and the microbiome. Live Long and Master Aging is a HealthSpan media production. We share ideas here, but we do not offer medical advice. If you have health concerns of any kind, or you're considering adopting a health-related regime, you should first consult with your doctor.